Question for you. Is our health care broken? If that's obvious to you, now the next question should be, why is our health care system broken? I'm going to break it down to you and give you the two main factors in why we're spending twice as much as the rest of the world on our health care and we're getting less results. Here's why. Number one, we have the wrong focus. All so-called supposed healthcare in America focuses on symptom relief and control rather than true health and wellness and actually correcting or changing the underlying problem or the underlying cause. And so, why is that? Okay, let me tell you why. Number one, it's all about control. At this point in time, Big Pharma controls the education of the medical professionals, okay? If you don't believe me, just step on any medical school campus and look at the buildings that are there by statin drugs and other pharmaceutical companies that make those type of drugs, and they're donating millions of dollars to these schools to make that work. The other problem is that all the research that's done today that used to be done in university is now beginning to be done privately, and even when it's not, now universities can actually be profitable and make money from their research and from their technologies, which didn't happen until the early 1980s. Okay, so when that changed, now all of our research is now beginning to happen and being controlled, the majority of it, by Big Pharma. So the education system and the research is now controlled by Big Pharma. Okay, if that be true, and it is, then guess what the focus is always going to be? The only treatment, and according to the FDA, the only treatment for a disease or condition is a drug or surgery. So it's always going to be more drugs, and that's always going to be the answer. The drugs are only going to focus on the treating the symptom. They're all going to have more side effects, so on and so on, and we never get to the underlying problem, and health becomes a downward momentum snowball that gets bigger and bigger and more problems as time goes on, and the list of your drugs, the bag that your drugs come in, gets larger every day. The second problem, not only do we have a problem with our focus, okay, but here is the real root of all of these problems, and that has to do with, it's all about the money. Now, I'm going to get spiritual here for a second with you. As a Bible-believing Christian, I've known this for a long time because the Bible says in 1 Timothy chapter 6, verse 10, that the root of all evil is the love of money. So, because healthcare now is a $2 trillion plus industry in America, which is unfathomable. I can't even grasp that, okay, put my mind around that, okay? So it's all about what's profitable. Let me give you an example. You may be aware that drugs can be patented, meaning they're chemical compounds. This is why there's no money in natural substance, because they can't be patented, because they're natural. That's why the pharmaceutical always has to come up with a new chemical, okay, that they can patent. If they patent it, they have for 7 years, nobody else can compete with them on that drug, and they can basically charge whatever they want. Let me give you an example to kind of help you wrap your mind around this. In 2008, the average cost for a new drug that was introduced into the market, okay, per year, now this was, you got a new drug, what's it going to cost you for the next year? The average cost of that was $2,115. That was in 2008. That wasn't really that long ago, 15 years ago, okay? Now, 2021, that number had changed from 2,115. I don't even know if you could guess what it went to. You probably think it at least doubled, maybe tripled. Yeah, not even close. How about $180,000 for annual cost for a new drug on average? I know that's hard for you to believe, but that's what insurance companies are paying for for this kind of thing, and they're getting their money from your premiums and my premiums that we're paying, and most of this is paid for by the government, which really means it's paid for by taxpayers like me and like you. Here's the next problem. From 2021, the next year, 2022, this number went from 180 to 220 something $1,000. Incredible increase in 1 year. You get the idea of where we're headed with this. It's unsustainable. And here's the big problem. Germany did a study from 2011 to 2017 on all the new drugs that were introduced. They found that out of all those new drugs, only 1 out of 4 actually had a significant improvement over the already existing drugs at a tremendous cost. They said 50% of them had absolutely no benefit whatsoever. And how do you know which ones are which? Unfortunately, you don't. I have a question. Why are the medical professionals going along with this? I don't know if you know the answer to that. I don't know the answer, but I'd like to know because they know. So, is our healthcare system broken? Yes. How's it broken? Because our focus is not on wellness. I'm going to address this in the next video. And it's also all about the money, and it's not about the results. We're going to address the things that can be done for you and your family to get out of the broken healthcare system, to begin to get more return on your health for your money that you're spending in our next video. So be sure you subscribe so you'll get that when we come out with that. And if you agree with me or if you don't agree with me, drop your comments down below. I'll look forward to hearing from you. And until then, live life well and God bless.